welcome to day 2 of the 7th annual Oswego County State Fair. I'm Teresa Wilson, president and founder of the Val Foundation and your host and facilitator for the State Fair. Up next, we have NARCAN Training with Sarah Bannock. She is the DSS Senior Therapist at Farnham Family Services. Sarah's been in the SUD field for 10 years. She's a credentialed CASAC, which is a credentialed alcohol and substance abuse counselor, and is currently employed by Farnham Family Services as a contract employee with the Oswego County Department of Social Services. There she provides case management for all the clients that are in treatment with the SUD providers, as well as completing screenings and assessments for those that identify with substance use disorder issues. Sarah is also the NARCAN trainer for Farnham Family Services and is available for other NARCAN trainings in the future. Welcome, Sarah.
Hello, everyone. So I almost said good morning, good afternoon. That's how busy I've been today. So first thing I will do is, I don't need to introduce myself because Teresa did all of that for me. So thank you very much, Teresa. Welcome everyone. Whether you've had the training or this is a refresher, first time, welcome. And I'm going to show you 2 little videos in the beginning. So Teresa will share her screen with me and I will pull those videos up and hopefully I can get them to work.
You are a co-host, you're all set.
Perfect. And then I'll go over the stuff that you have that you'll get in your bag. We can figure out how to get your own, because everybody that's participated here today will end up with their own NARCAN kit. So we'll come up with a way that you can pick up your kits, whether you go to Farnham and pick them up, or you can come here and see me at Social Services and pick up your kit. I could meet you someday at Dunkin' Donuts across the street and pick up your kit. It's very, very simple, and I will do what we can to get this to you because it's very important that you have it.
Sarah,
yeah.
I have a question. Could you explain the minimum age requirement for receiving a kit to use? We do have youth on the call today.
So I've never really been given a minimum age. As far as I've always been told, it's parent discretion. Personally, I would say probably 16 is, that would be the youngest I'd have without a parent. With a parent, probably 13, 14, but they'd have to be extremely mature because I do know that there are parents that are still using and have younger kids in the home. I know my daughter is 9 and God forbid if something, like if my husband used or something like that, she's very responsible, she's very mature. I could show her how to use this. Say if I was in the shower and something happened to my husband, she is smart enough to know how to use this. It's very simple. You stick it up their nose and push the plunger. So I wouldn't necessarily train a 9-year-old by herself, but if it's that severe, then I would encourage a parent to at least show the children in the home where this is located and how to use it. As far as training them on their own, I wouldn't have any problems training, sitting down with a 16-year-old that's very, very mature, very understanding, especially if they're in the coalition, about what's going on because they know about it. Does that answer your question?
Thank you, Sarah. Someone says that we can't see you. Have you shared your screen yet?
Oh.
Or I'm not sure why we don't see you.
I don't know. I see all of you guys.
Can everyone see Sarah when she's talking? Okay.
Whoops, where'd you go?
I think you're good. Sorry.
All right, so let's see here. I'm going to do the first video. See my screen? Is there a little blue guy that you can see?
Yes.
Perfect. Thank you. All right, so this video is done by the National Institute of Health. It just gives you a little bit of background on opiates and what the naloxone or the NARCAN does. Just over 5 minutes, so I'm going to go ahead and show this video. Share computer sound.
Very good. All right.
Saves lives.
Oh, we hear it.
No time to sit idly by. More and more people are dying of overdose from the likes of heroin, fentanyl, and prescription pain medications like oxycodone and hydrocodone. These are all examples of opioids. Opioids are drugs derived from the opium poppy plant or made in the lab. They can treat pain, cough, and diarrhea. But opioids can also be addictive and even deadly. The number of opioid overdose deaths has escalated more than 400% since the turn of the century, with tens of thousands of lives now being lost every year. But many deaths can be prevented with a life-saving treatment, naloxone. When given right away, naloxone can work in minutes to reverse an overdose. Naloxone is safe, has few side effects, and some forms can be administered by friends and family. When is naloxone used? You can save a life. First, recognize signs of overdose: limp body, pale, clammy face, blue fingernails or lips, vomiting or gurgling sounds, inability to speak or be awakened, slow breathing, or heartbeat. If you see these symptoms, call 911 immediately and consider the use of naloxone if available. How is naloxone given? Home preparations include a nasal spray given to someone while they lie on their back, or a device that automatically injects medicine into the thigh. Sometimes, more than one dose is needed. The person's breathing also needs to be monitored. If the person stops breathing, consider rescue breaths and CPR if you are trained, until first responders arrive. How does naloxone work? Naloxone is an opioid antagonist, which means that it blocks opioid receptors from being activated. It is so strongly attracted to the receptors that it knocks other opioids off. When opioids are sitting on their receptors, they change the activity of the cell. Opioid receptors are found on nerve cells all around the body. In the brain, opioids produce feelings of comfort and sleepiness. In the brainstem, opioids relax breathing and reduce cough. In the spinal cord and peripheral nerves, opioids slow down pain signals. In the gastrointestinal tract, opioids are constipating. These opioid actions can be helpful. The body actually produces its own opioids called endorphins, which help calm the body in times of stress. Endorphins help produce the runner's high that helps marathon runners get through grueling races. But opioid drugs, like prescription pain medications or heroin, have much stronger opioid effects, and they're more dangerous. Over time, frequent opioid use makes the body dependent on the drugs. When the opioids are taken away, the body reacts with withdrawal symptoms such as headache, racing heart, soaking sweats, vomiting, diarrhea, and tremors. For many, the symptoms feel unbearable. With continued use, opioid receptors also become less responsive, and the body develops tolerance to the drugs. More drugs are needed to produce the same effects, which makes overdose more likely. Overdose is dangerous, especially for its effect in the brainstem, relaxing breathing. Breathing can be relaxed so much that it stops, leading to death. Naloxone knocks opioids off their receptors all around the body. In the brainstem, naloxone can restore the drive to breathe and save a life. But even if naloxone is successful, opioids are still floating around, so expert medical care should be sought as soon as possible. Naloxone works for 30 to 90 minutes before the opioids return to their receptors. Naloxone may promote withdrawal because it knocks opioids off their receptors so quickly. But otherwise, naloxone is safe and unlikely to produce side effects. Naloxone saves lives. From 1996 to 2014, at least 26,500 opioid overdoses in the United States were reversed by laypersons using naloxone. While naloxone is a potentially life-saving treatment, more needs to be done to solve the opioid overdose epidemic. The National Institutes of Health launched the HEAL initiative in 2018, expanding research across multiple NIH institutes and centers to speed scientific solutions to the national opioid crisis. Research is underway to improve treatments for opioid misuse and addiction, and to enhance pain management. The National Institute on Drug Abuse, or NIDA, is a leading NIH institute for research on opioid misuse and addiction, and its support helped the development of the user-friendly naloxone nasal spray. For more information, see NIDA's website at drugabuse.gov and search naloxone, or visit nih.gov and search NIH HEAL Initiative. General opioid information can also be found at medlineplus.gov. This video was produced by Medline Plus, a trusted source of health information from the National Library of Medicine.
I don't know either. Stupid technology.
Yeah.
All right. So does anyone have any questions from that video? Yes, no? All right. So before I go into the next one, one thing I wanted to share with you, I get different emails, and one of the ones that I just got from the New York Times, I don't know if anyone else has heard of it, but one of the biggest things that I just found it so exciting is Purdue Pharma, who is one of the biggest makers of some of these opiates. They're the producer of OxyContin. They're going to plead guilty to criminal charges, and they face $8.3 billion in fines over this opioid crisis. That is amazing. Absolutely amazing that they're going to have to face these fines and they have felony charges. I mean, when I read that, I got goosebumps. It's absolutely incredible that that's going to happen. Plus, they're also going to have to pay at least $225 in civil penalties as well. So they can afford it. It's a lot, and it's not going to stop there. This is huge strides for this. Hopefully, they'll put that money to good use and make more programs and more things available to continue to combat this problem. But that's such a huge step in the right direction. I just wanted to share that with everyone. All right, so now I am going to try and share the second video. Let's see what happens. One second. All right. Share computer sound. Can you hear me?
Yep, I can hear you.
Did
so
you hear the
far.
video? Oh, hang on. Got it.
Nasal spray is not a substitute for emergency medical care. As with any drug, you need to be aware of important safety information concerning its use. Please see indications and important safety information at the end of this video. Also, please see accompanying full prescribing information in the use of this product. NARCAN nasal spray is an emergency treatment for a known or suspected opioid overdose. The appropriate use of NARCAN nasal spray can help you save a life. NARCAN nasal spray is not a substitute for emergency medical care. As with any drug, you need to be aware of important safety information concerning its use. If you encounter someone who is unresponsive and you suspect an overdose, first shake their shoulders and shout their name.
Kevin.
Ask if he or she is okay.
Hey, can you hear me?
Check for signs of an overdose, unresponsive to touch or voice. Breathing is slow, uneven, or has stopped. Snoring, gasping, or gurgling sounds. Fingernails or lips are blue or purple. Administer NARCAN nasal spray as quickly as possible if someone is unresponsive and an opioid overdose is suspected, even when in doubt, because prolonged respiratory depression may result in damage to the central nervous system or even death. Lay the person on their back to receive a dose of NARCAN nasal spray. Remove NARCAN nasal spray from the box. Peel back the tab with the circle to open it. Remove and review the printed quick start guide inside the package. Hold the NARCAN nasal spray with your thumb on the bottom of the plunger and your first and middle fingers on either side of the nozzle. Do not press the plunger to test or prime the device. If you do, you will waste all or part of the dose of medication. Tilt the person's head back and provide support under the neck with your hand. Gently insert the tip of the nozzle into one nostril until your fingers on either side of the nozzle are against the person's nose. Press the plunger firmly to give the full dose of NARCAN nasal spray. Remove the device from the nostril after giving the dose. After you have given this medication, seek emergency help right away. NARCAN nasal spray is not a substitute for emergency medical care.
I'm with somebody who stopped breathing. I think they've had an overdose.
Move the person on their side after giving NARCAN nasal spray. If possible, put their hands under their head and bend their upper leg forward. This helps prevent the person from rolling onto their stomach. This is known as the recovery position. Continue to watch the person closely. If they do not wake up or respond to your voice or touch, or if they do not seem to be breathing normally within 2 to 3 minutes, use a new NARCAN nasal spray to give an additional dose in the other nostril. Acute opiate withdrawal symptoms may occur from use of NARCAN nasal spray in patients who are opioid dependent. Symptoms include body aches, diarrhea, increased heart rate or tachycardia, fever, runny nose, sneezing, goosebumps, also known as piloerection, sweating, yawning, nausea or vomiting, nervousness, restlessness or irritability, shivering or trembling, abdominal cramps, weakness, and increased blood pressure. When the emergency is over, put the NARCAN nasal spray back in its box and throw it away in a place that is away from the reach of children. In addition to watching this video, please read the quick start guide that comes with NARCAN nasal spray before using it. Talk to a healthcare professional if you have any questions about how to administer NARCAN nasal spray. Please read the indications and important safety information that follows. Store NARCAN nasal spray at room temperature between 59 to 77 degrees Fahrenheit, 15.
I'm gonna, let's see. All right, can you hear me?
Yes.
All right, so I'm gonna stop the video there because the rest of it all goes into all of the pharmaceutical information and things like that. And I also wanted to stop it because where it was talking about the storage of this medication, new guidance has come out from the FDA changing the temperatures. So let's see here. I do have, the temperature has increased. It'll stay stable up to 104 degrees as long as it's not left repeatedly over and over. You know, don't leave it in your car for a week at 104 degrees, but if it's up to that, you know, for a day or so, it'll be all right. It's not going to hurt it. The best news is all of this medication was originally made with when it was made, it had a 24-month expiration on it. So most medication does not expire the day that's printed on the box. You know, it doesn't stop working the moment it expires. So originally, because that's the thing, people, you know, what happens when it expires? Do I throw it away? And I was just instructing, you know, call me when it expires, I'll give you a new kit, you know, just toss it. And I did some more research on it, and everything I was finding said it held all of its chemical properties, all of its molecular properties, at least 10 months or longer past its expiration date. So the FDA has done some studies, and I think it was another company, Emergent Biosolutions, I think is the name of it, along with the FDA, and added another 12 months to already existing kits. So I have all the kits that I have right now expire, they say they expire either January 2021 or October or September of 2021. I was instructed by the Department of Health program that I get these through to continue to use them, give them out, because they have another 12 months on them. There is nothing wrong with them. Give out the paper with them because they haven't made up new stickers or tags to go on the boxes. So they all have another 12 months, which was fantastic because I had probably about 150 kits that I thought were going to expire in January. She's like, no, don't throw them away. So that is amazing. When I heard that, I was so happy. So some things about that video that I do a little differently. One of the things, as far as shaking them and hollering their name, if they're out, they're not going to hear you. I was always taught to give them a sternal rub because you don't have to use a lot of pressure. And on your sternum, there's not much skin. It's bone. So you take your knuckles and you just put it right on their sternum and just give a little rub. And even if you do it to yourself, you don't have to push very hard, and you just rub a little tiny bit and you can feel it. It's a lot easier than just trying to shake someone. And if you're nervous and you shake them, you might shake them too hard and bounce their head off the floor. You might not want to do that. So just make a fist, give them a sternal rub. If they don't respond to that, then they're definitely not going to respond to you hollering their name. So like they said, you open the package. You are not going to have time to review this quick start guide. That person is going to be out. They may or may not be breathing. So throw it to the side. You're already going to know how to use this. This is exactly what the medication looks like. It's just the little plunger, just like they showed you in the video. So you take it and you stick it all the way up their nose, as far as it'll go to your fingertips, touch the bottom of the nose, and then push. It's a very fine mist that comes out, and then that's it. Set it off to the side. Like she said, roll the person on their side facing away from you, because a lot of times when somebody overdoses, it's not intentional. They don't realize they've overdosed. So when they wake up, they're going to be disoriented. Anyone that I've talked to that has overdosed, they don't know what's going on when they wake up. When they wake up, there's a lot of people around. They don't know what's going on. EMS might be there. You're there. They could wake up and vomit. You don't want that coming back at you. They could wake up irritated and belligerent. You don't want that. So just roll them on their side facing away from you. If they're on their back, they could aspirate, and same thing if they're on their stomach, and you don't want that either. Put them on their side away from you. And as it said, wait 2 to 3 minutes. So that's the best time to call 911 is after you give them that first dose. If somebody is with you, they can be calling 911 as you're giving the first dose. So wait 2 to 3 minutes after you give the first dose. If they don't come back after that first dose, roll them back on their back and administer the second dose up the other nostril. If the other nostril's blocked, doesn't matter. Use the same one you used before. Get it in there any way you can. And then same procedure. Roll them back on their side, facing away from you, and wait. Hopefully by then EMS is almost there, or they start to wake up. And if they don't, after 2 to 3 minutes, that's when you roll them back on their back and start with rescue breathing. Inside your bags that you will receive from me, you get your kit, and there is a little plastic bag that says Safety Works on it. It's a rescue breathing face shield. It tells you 2 quick breaths, then 1 for every 5 seconds. And when you open it up, it looks like this. So you just place it over their mouth and blow. I had somebody the other day when I gave this training, they're like, well, what about COVID? That's up to you. I can't tell you yes or no. If you know the person and you're comfortable using this and putting your mouth on them, go for it. If you don't want to, that is totally fine. If you want to wait for EMS to show up, go for it, because they're going to have the little bag to put over their mouth and they can just start giving them breathing by using the bag. I was talking with one of the probation officers the other day who is also involved with the Oswego Fire Department, and he was telling me he wouldn't be surprised if some of like the mouth-to-mouth breathing goes away altogether and it's just done by the bag. Wouldn't be surprised. You know, I mean, COVID's changed a lot of things. So if you know them and you know they're safe, go ahead and give them rescue breathing. Do what you can. One thing though to be very mindful of is it absorbed in the nasal passage or the airway? Is the airway is blocked? Yes, it's absorbed in the mucous membranes in your nasal passages. So it'll go right up. Like I said, if you can tell that like one side is blocked, then use the other side. You should be able to get it up one side or the other. Does the bag have 2 plungers? Yes, there's 2 plungers in each box of NARCAN. Let me see if there's any other questions that I've missed. I think those are it for right now. Okay, so then let me see. Waiting for EMS to show up. It's very important. So this medication, like they had said in the first video, and well, I don't know if they mentioned it in the second one, only lasts 30 to 90 minutes. So make sure, encourage that person to go with EMS, the fire department, anybody to get checked out. They should go to the hospital, get checked out. It's definitely well within their rights to refuse. If they refuse, stay with them, because they can fall back into that overdose. That medication only lasts 30 to 90 minutes. Those opiates are still floating around in there. Depending on how much they've used, what they've used, they can go right back into that overdose after this NARCAN wears off. Especially if they're using fentanyl or if their stuff has carfentanil in it and they just don't know. It can be very dangerous if it wears off, or they get NARCAN and they use again. That happens a lot too. They use it once, go for it again. Use it, you know, there's a lot of people that are NARCAN'd multiple times in one day because they just continue to use. Let's see here. Yeah.
I do have a question.
Sure.
And I have to tell you that your time's a little over.
Yeah, I see that.
And I do have another presentation. What if it's not an opioid overdose?
It will not work. Right. When in doubt, use it. You'll know if it doesn't work. And that's basically the thing. If it doesn't work, then it's not opiates. It will not work on alcohol. It will not work on Xanax or Klonopin or anything like that. It will only work on opiates. Heroin, Vicodin, oxys.
But it won't hurt?
It won't. No, it will not hurt you. If a kid were to get a hold of it and squirt it up their nose, it will not hurt them. I could sit here and squirt it up my nose right now. It's not going to do anything to me. It's very safe. It's effective. There are little to no adverse effects from it. It's basically a harmless medication, and it does its job.
Thank you, Sarah. Now, anyone who would like a kit from Sarah, please leave your name and your email in the chat. And
I'm going to put my email address right now in the chat. So if anybody's got some questions,
Great.
feel free to email me. And I can do that too.
Thanks, Sarah, and I'll be sure to get everyone's name and email to you so you can contact them for
Okay.
getting it as well.
Perfect. Sorry I went over. Sorry for all the computer issues.
No problem. I think I can cut that out.
Yeah, I will never forget how to do that though.
Exactly. Thank you so much.
Thank you, everyone.